Hi, my name's Lauren and I'm doing my baby assessment. Here's my baby. I'm gonna lift her up for the purpose of being able to see me, but normally it would be laying down, so I wouldn't do that. First I would make sure WIPO is done, make sure I have hand hygiene, identify myself, identify patient, make sure mom's bracelet and baby's bracelet match. They do. Allergies, no known allergies for at the moment so far. Explain what I'm doing. I am doing a baby assessment. Provide privacy if needed. First, I'm just checking the skin color. She looks good. We're under a warmer. I'd like to note that because she has no clothing on right now. Skin color's good, intact, no lesions. Looking at eyes, they're even with the pinna. Brisk. I'm gonna come down to the chest. Look symmetrical, no lesions. Colors appropriate for ethnicity. I'm going to listen to the heart sounds. I'm going to first listen at the left side, on the right side, the pulmonic, right side, sternum border, second intercostal space, and I'm going to go to the left side, right side aortic, right side aortic, second intercostal space. I'm going to go to the left side pulmonic, second intercostal space, sternum border, and then I'm going to go down to the third intercostal space, left side sternum border. That's going to be the Erb's point. Then I'm going to go to fourth or fifth intercostal space, depends. That is the tricuspid. That's left side sternum border. And then I'm going to go to the nipple line. That will be right under the nipple line, the mitral valve. And I listen to that for 1 full minute, time lapsing it. I would have a pediatric baby stethoscope, so it's going to be a little big. I'm going to lift her up so you can see. Okay, I did not hear any heart murmur. I could hear heart sounds in each one. It was good. All sounded normal. I'm going to check her heartbeat. Time lapse, I got about 165. Normal's 110 to 170, so she's in normal limits. While I'm here, I'm going to check respirations. So time lapse, I got 35, normal's 30 to 60, so she's in normal. There was no grunting. I noticed no flaring with her respirations. But I am going to listen to some lung sounds now. Going to the side. On the back, I am staying in between the scapula. Alright, the lungs sounded clear, unlabored. While I'm back here and I've got her on turned a little bit, I'm going to check for the spine for alignment. The spine is aligned, checking the sacrum, no lesions, not moist, checking the rectum. Looks good. There's no lesions, drainage, so that's good. I'm now going to go just to the abdomen. You do not palpate on a baby's abdomen, so you can look, so it's symmetrical, symmetrical, even, colors appropriate for ethnicity, and I can listen to the bowel sounds. Again, do not palpate. I'm going to listen from right lower to right upper, left lower. All right, it's bowel sounds were clear. Bowel sounds heard in all 4 quadrants. I'm gonna check the genitals. I have a girl, there's no drainage. I'm looking for that. Lesions on it or anything, good. If I had a boy and they were circumcised, I would check to make sure. I would look at the circumcision for any signs of infection as well. Make sure that there's no redness, drainage. Look at that. There was a little bit of meconium, which is normal around this age, so that's okay. Urine was clear, yellow, no odor, no particulate matter, so that's normal. I'd asked mom about feeding habits. Mom says that feeding is every 1 to 2 hours. That's normal. breastfeeding wise, so that's good. I'm going to check the fontanelle interior and posterior, making sure that there's no dents. I'm going to check the suture lines. It's good. There's no dents. Everything looks normal. Scalp is good and even. No drainage from the ears or the eyes or the mouth or the nose. Sclera is white. Conjunctiva is pink. The mouth is moist. Intact. No lesions. Color's appropriate for ethnicity. I would have a bulb syringe. I don't have one or could find anything that even remotely looks like one. So I would squeeze it away from me, then bring it in, and I would get the eyes, get the nose, suck eyes, nose, side of the mouth. All right, get that out. I'm gonna take the temp. I'm gonna take an auxiliary. So this is my thermometer. I got 97.9. That's normal because the normal limit range is 97.6 to 99.5 Fahrenheit. I'm gonna put on some gloves. Well, first I'm gonna check the face. I'm gonna touch the cheek. I'm looking for rooting, making sure if I touch a cheek, that's the side she goes on. So she did that. That's good. I'm gonna put on gloves because before I go into the baby's mouth, I showed you that. I'm putting my finger in the mouth. I'm looking for a cleft palate, teeth. There is none of that. That's good. That'd be abnormal. No other abnormalities. Okay. I'm gonna check the palmar grasp. Okay, that's strong. I'm gonna check the Moro reflex. So that's where I pull up, and then they should go back in and down and go back to normal. Arms are symmetrical, legs are symmetrical. Again, all appropriate for ethnicity, no lesions. I'm gonna check the Bavinski sign. So I do my finger up and across, and the baby's toes would flare out, and I could do the plantar reflex, and the baby's toes would curl and grab my thumb. There are 10 toes, 10 fingers. They all have nail beds. I'm checking for capillary refills. They're brisk, under 3 seconds. Toes, capillary refills, brisk, under 10 seconds. Checking the umbilical cord for infection or anything. It looks good. There's no infection, no drainage, no odor. Looks like it's doing pretty well. Checking clavicle. It's good. Symmetrical. No crepitus. I think. So I would put the baby's clothes back on, put a hat on her, maybe some socks. Sorry, I don't have my blanket ready. I'm gonna swaddle her. That's her swaddle. When I checked the mouth, I also made sure that there was a good sucking reflex to make sure that she was getting the milk properly and stuff. She had a good one. Just making sure for that. And I was also checking the pulses. I forgot about that. I checked her brachial. They were even, +2. I would check radial, even, +2. Femoral, even, +2. Dorsalis pedis, even, +2. And the pedial pulse, posterior tibial, +2, even. Okay. I've gotten her clothed in a blanket, hat. I would give her back to the mother. Make sure that she had everything she needed. Everything was in reach for them, education given if needed, call light and reach, bed in Lowe's position, and be back to check on them, hand hygiene, and leave the room.